In this video, I'm going to show you how to log into our cloud-based website, padnet.us, for the first time once you receive new credentials, and then how to schedule a patient through this website. To start, you're going to take the username and the temporary password provided to you, most likely in an encrypted email. And it will bring you to this page where it says your password has expired. From here, you will change the password using the fields provided, and then we'll agree to the terms and conditions. Now from here, there will be two tabs that become apparent to you. There's the test tab that documents all of your tests at various stages of the interpretation process, from scheduled to where the tests have not been completed but have just been scheduled. In unsubmitted, we have the tests that have been completed but not sent to a physician. Submitted, we have all of our tests that have been submitted to the physician but not interpreted. And then, of course, interpreted is where all of the tests that have been interpreted by our reading physician will rest. We also have our patients tab, which includes a database of all of the patients we've worked with. We're going to assume that we're working with a patient that we've never added to our database before, so we're going to click Create New Patient to add them. From here, everything with a red asterisk is required. On this page, there are two things I want to point out. First, we have our PIN number. The PIN number can be manually entered, and it can be a social security number, an EMR account number, an insurance policy number, whatever your office likes. Or we can opt to auto-generate it, which will gray out the box. The other thing I want to point out are these three tabs right here. Race, ethnicity, and preferred language are required, but you'll notice that not specified is one of the options in the drop-down menu, and that is a valid option. So we can leave them as not specified for now. Once we're done with this page, we can go on and click Save and Next. From here, we enter the patient's insurance information. Now, if you are a test site that's sending your information to an outside physician, they will want that insurance information as well. So we'll include the insurance type and a carrier. Now, if we need to add a new carrier, we click that plus button, type in the information there, and click Save. Once you add a carrier for the first time, they will be an option for all future patients. Last thing we'll enter is a policy number. Now, for offices who are reading internally, your physician will already have the information because it's all in the same facility. So because it's all in the same facility, you'll enter scanned document in both cases, and you'll notice that policy number is no longer required. Once we're happy with this, we can move on to Save and Next. If there's a secondary policy, we check that box and we do it again. Now that we've created our patient demo, we're going to schedule a test for them. We're going to schedule an arterial test, so we're going to select PAD. This is going to bring us to the page where we enter our ICD insurance codes and our CBT procedure codes. Now, it is important that you have an indication code for a patient that you're hoping to get reimbursed for, because this is the only way that insurance will reimburse you. So, we can filter for indications in one of a few ways. We can either look for it manually in the list. We can filter by code, or we can filter by condition. You notice all descriptions with claudication appear. Risk factors, we can do the same thing. If a patient has symptoms of risk factors, you want to include them, but they are not required for reimbursement. Lastly, we want to look at our procedure codes. We include the code and a description of the procedure, and you'll select the option for the procedure that's most relevant. Most commonly, we see the 93923, and you'll select this option if you're doing a standard full arterial study. So as the software says, this is including 3 levels of PVRs and an ABI or a TBI. If you're doing any variants of the test, you might be considering selecting other codes, such as the abbreviated version, or the version with post-exercise. Or perhaps you're doing the provocative functional maneuvering version of the 93923. The scheduling process is a bit different for that test, and there will be a separate video about that scheduling. Once you have your procedure codes, your indications, and your risk factors, you can go ahead and click Save and Next. From here, we have our Histories, Conditions, and Medications tab, notes that are seen by the doctor and the patient. We have a Reports Notes tab, notes that are printed on every single copy of the document seen by everybody. We also have a tab to add history of vascular procedures. You select the procedure, fill out the required information, and click Save. Or if you accidentally select one, you can hit Cancel as I just did. Nothing on this page is required, but these are all fields that you can use. Now lastly, you'll notice that based on the procedure code we selected, some of the test segments are already selected. The standard 93923 is going to automatically select blood pressures in the left ankle and arm for a left ABI, the right ankle and the right arm for a right ABI, and the 3 levels for PVRs are going to be above the knee, the calf, and the ankle on both sides. If we know ahead of time that we need to amend this test, for example, a patient with a mastectomy on their left side, we could deselect the blood pressure in the left arm. Conversely, if we know that a doctor is interested in getting PVRs for the toes as well, we can go ahead and add those right here. This is not the point of no return, for all test segments will be available to select or skip when you're actually working with the patient. However, it sorts it in a very nice way if you select it ahead of time. So if you know, it makes the testing process much easier. From here you can add height and weight for a BMI. Now if you're ready to perform your test with the patient in their cuffs and then finishing their rest period, you can click this Perform Test button and it will bring you straight to the testing website. We're going to act like we're scheduling a patient a few days in advance, so we're going to click Schedule Test, and we'll now see that our patient demo is one of our scheduled tests. Of course, if we'd like to remove this test, we can do so by clicking Delete. And that's how you schedule a patient.